A lot of people are told they have cataracts, and then what? Just wait. And so they end up waiting for years and years, wondering, hey, is now the time to have cataract surgery? Is it now? And it can cause them a lot of worrying and a lot of stress. And a lot of times, waiting is the right answer, but there are sometimes people wait too long and can cause their daily life to be harder than it needs to be. So the question is, how do you know when is the right time to get cataract surgery? Let's focus in. So just a quick recap of what cataracts are. Now, we all have a crystalline lens inside of our eye, right behind the color part of the eye, the iris. And this lens is one of the parts of the body that continues to grow over time. So every year it tends to add on a layer, kind of like an onion layer. It tends to get thicker, harder, less flexible, and starts to cloud over and change colors a little bit. And that's why it starts to affect the vision. Now, what makes this tricky is that this process is usually really slow. It's very gradual. And so it's really hard for people to notice that this is even happening or that it's even affecting their vision. It's kind of like gaining weight, maybe gaining a pound every year or half a pound every year, and you go 20 years and all of a sudden you're like, whoa, I'm 20 pounds overweight. So there's really not one moment where you know, hey, the cataracts are all of a sudden bad enough right now. It's just so gradual, it's hard to notice. So here are the top 3 signs or signals that can tell you, hey, yeah, maybe now is the time to get cataract surgery. The first sign, and this is probably the easiest one to know if it's really time to get cataract surgery, and that is where you measure on the visual acuity chart. Now, the visual acuity is the measurement that an eye doctor uses to know where your vision is at. That's usually when you're looking at the eye chart and trying to read the lowest line that you can get. The lowest, smallest one that we usually show people is the 20/20 line. The number that you need to remember for this is 20/40. So it goes 20/20, 20/25, 20/30, 20/40. And the reason why you want to remember this number is because in most states, you need to be able to see 20/40 in order to pass and keep your driver's license. So this is the line that you need to see to be able to legally drive. This is when an eye doctor is going to start strongly recommending, maybe being a little bit pushy, to have you be referred or at least a consultation for cataract surgery. Because this is where it might get awkward, because if you're worse than 20/40, this is where we have to say, you know what, you aren't able to drive. You aren't able to keep a driver's license legally meeting the visual requirements. Now, saying this does not mean that you have to wait until your vision is worse than 20/40. In fact, I would say the vast majority of people that get cataract surgery are doing that probably before their vision gets to 20/40, 20/50, just because it is bugging them or affecting their quality of life before it gets to that point. And that brings up signal number 2, and this is probably the most clinically important, and that's the quality of life impact. How much or how bad are your cataracts affecting the quality of your life? Is it starting to keep you from doing things that you used to be able to do in your daily activities? Are you starting to get scared with driving? Maybe night driving is becoming even more difficult. You have more glare. You're starting to feel like you're not safe on the road. You're not safe driving with others. Maybe you aren't able to sew like you used to. You are having difficulty reading, especially in certain lighting levels. You maybe wanted to do some crafting and now you can't see the details anymore. Even little quality life, daily activities, if it's affecting that, then cataract surgery should be considered. Probably one of the biggest ones that we see a lot is glare, nighttime glare. In fact, there is a test specifically relating to insurance and being approved for cataract surgery. There's something called the glare acuity test. So some people, maybe their vision is still 20/20 with glasses, they can still see great, but their glare is really bad. And there's a way to test for this called the glare acuity test. So pretty much basically you shine a bright light into someone's eye and then you have them read on the chart just to see how much glare or lighting affects their visual acuity measurement. For number 3, there's a few that might be wrapped up in the same one, and that's when your eye doctor might mention, hey, it might be a good idea to get cataract surgery. Even if it might not be affecting your daily activities, your vision isn't at the 20/50 line or anything like that, but an eye doctor might still say, hey, you know what? it might be good to get cataract surgery. And here's a couple examples why this might be. One, sometimes the development and the advancing of cataracts can start to cause the vision or the prescription of your glasses to shift. Sometimes we'll call this a myopic shift, or a shift more nearsighted, or sometimes people have a hyperopic shift. They get more farsighted, and it can cause the patient to need to remake the glasses, get new prescription glasses more often than usual, and can sometimes start driving them bonkers. The good news is when they get the new glasses, they can still see 20/20, they can see great. It's just their vision is just constantly changing faster than they're used to. So sometimes in that case, it might be good to consider cataract surgery just to get that crystalline lens out of there to stop the shift and just kind of reset the vision. Another example is sometimes as eye doctors, we are looking in the back of the eye, inside of the eye, to monitor certain health conditions, making sure that the eye is healthy, the retina is healthy. So we might be looking at blood vessels, looking for diabetes or blood pressure. Maybe we're monitoring glaucoma or macular degeneration. And if the cataracts are advanced enough, sometimes it limits or restricts our view to be able to properly monitor the retina. So sometimes the doctor might say to the patient, hey, cataract surgery might be mutually beneficial here. If we get the cataract out, it can help your vision, but it can also help our vision or our view to look inside of your eyes to monitor the health. Okay, now talking about the flip side, when is it okay to wait to have cataract surgery? You've been told you have cataracts, but maybe they're just not bad enough to where you don't have to worry about it. You don't have to stress about it. It's okay to wait. The big one is if it is an early cataract and there's no impact on your quality of life, meaning maybe you didn't even know you had a cataract until your eye doctor told you, hey, you have cataracts in there, because it wasn't changing anything you were doing in your life, then yeah, just know you have it, and then don't even put any other thought into it until you go into your eye exam next year. If your glasses prescription is changing, like I mentioned, and it might be from the advancing cataracts, it's still okay. You can get new glasses, and maybe you get 20/20 vision with those glasses and see fine. It might be a little bit annoying to have to remake the glasses or get a new prescription more often than you used to, but if you're okay with that and your vision is still great, then yeah, definitely okay to wait. You do not need to have the cataract surgery. And last but not least, cataract surgery is still a surgery. So there are potential risks to the surgery. Now, cataract surgery is one of the most successful and one of the most common surgeries done. And so it is a fairly easy surgery to recommend to patients just because of statistic rates. But it is a surgery, and with a surgery does come certain risks. And so depending on the person, their health conditions, sometimes we might want to wait a little bit longer just to avoid those risks or really make sure that it's worth it. So the bottom line here, and probably the takeaway message, is cataract surgery isn't about hitting a certain line on the chart. Now, I know I just said, hey, remember the 20/40 line, because that's an important line on the chart to remember of when you should get cataract surgery. There's a phrase that a lot of eye doctors use, and they say 20 happy. Is that patient 20 happy? And so what we mean by this is there might be somebody that might have 20/25 vision. Maybe they can't see the bottom line of the chart because their cataracts are affecting them, but they are doing everything that they want to do. They are still driving okay. They're still doing their hobbies. They're watching TV. They're going outside. They're going hunting. They're doing just fine. Does this person need to have cataract surgery? No. Now, on the flip side, there might be someone that is 20/25, and they might be saying, wow, I am just so used to 20/20 vision. I'm used to seeing the details on my woodworking. I don't really feel safe driving anymore. This person is not 20 happy. And so this person, yeah, we'd be more prone to having the conversation about having cataract surgery. So is your vision 20/40 or better, and are you 20 happy? I guess that's the question that you have to ask yourself. But if you have any other questions, you can leave them in the comments. I'll do my best to answer them there. In the meantime, you can learn more about cataracts from my video playlist right here. Hopefully this helped make things a little bit more clear. Stay focused.